Good morning and welcome back to Interclean Amsterdam from the RAI. The first healthcare cleaning forum was organized on this event just 2 years ago. And the main reason for organizing a healthcare cleaning forum was about the gap that there is between cleaning in hospitals and healthcare facilities on one side and infection control on the other side. And that's a risky gap because both should be on the same page and should be well organized and well done. So cleaning in hospitals actually became a spear point of the World Health Organization, WHO. Together with them, this specific event was organized with the World Health Organization. And we proudly present you two absolute top key speakers. First of all, you can see them in split screen. On the left, Dr. Pierre Pernax, Public Health and Hospital Hygiene Doctor at Bordeaux Hospital University Center. Good morning and welcome to you. And to the right, you see Professor Didier Pittet, Infectious Disease Expert and Professor of Medicine and Hospital Epidemiology in Geneva, Switzerland. Thank you so much.
Good morning.
Good morning to both of you. Mr. Pittet, first of all, Professor, I would like to invite you to take the floor. The next 15 minutes are yours. You will be talking about COVID-19 and the healthcare environmental hygiene.
Thank you very much. If I may have my first slide on the screen. COVID-19 and health care environmental hygiene is, of course, a topic that is very important today. If I may have my second slide, it's a pleasure for me to introduce these, but before we need to discuss the overview. Cases and morbidity all over the world. And these data are from November 2, and there is no need to say that we have a huge number of cases, a huge number of deaths. And as you know, these numbers are changing all the time and every day. And this is really an issue for all of us as of today, not only in the hospitals, but also in the community. But of course, the better we perform in the hospitals, the best for our patients and for our healthcare systems. The next slide is showing to you, if I can have the next slide, is showing to you the COVID-19 prevalence by country with high prevalences in different countries around the world. No time for me to discuss. These are the data of last week. It gives you an accurate vision of the situation. No need to say that in the Asia-Pacific region, it's now much less important, but still present than it is in the rest of the world, in particular in Europe or in America, North America, South America. I have no time to show you today data by mortality by country or things like that. This is not the purpose of the discussion as of today. But it's very clear that the impact on the healthcare system is tremendous, and the impact on the community is absolutely tremendous. The next slide is actually the next slide is actually looking for you at countries with the largest increase in new cases. And on this slide, which is not made to be seen appropriately, is to show you that the second wave that is following the first wave that we all had to sustain in the spring is actually very important. It's even more important than the first wave, as you can see this from this slide. And it's a reality all over the world. But here I can concentrate on some of the countries. But in particular in Europe, this is a very serious problem. But it is also a very serious problem in North America and South America. In North America and in the United States in particular, we can say that they are still in the first wave, and probably the second wave will come in this first wave, so it will make it a little more complicated and more impactful. The next slide, please. On the next slide, you see the mode of transmission of the virus. And as you can see, as you know, from one person, you can spread to several persons. The so-called R of the virus is that between one person, you can contaminate 2 or 3 others. And then the mode of transmission is actually so known that it's like any respiratory virus. And like any respiratory virus, meaning that actually you could spread the virus through droplets by coughing or speaking or thinking. And the droplets could directly impact on your next door person or the person who is close to you. But one of the most important other way to contaminate and cross-transmit the infection is through the surfaces. So it means that while you're talking or speaking or touching, the material is going through the environment, and then from the environment with your hands, directly or indirectly, you could contaminate yourself by touching yourself, or you could contaminate others by contaminating others. This is to say that the mechanism to stop transmission is very simple. You just have to take distance from one other person, and you have to clean your hands on a repeated way, and of course, to clean the environment. And we'll come back and concentrate today on this aspect. Next slide, please. What is very important is to realize that the transmission patterns among healthcare workers exist. You have a COVID patients or a non-COVID patients. But unfortunately, if your practices are not correct, you could contaminate yourself as a healthcare workers, and you can contaminate others. So non-COVID patients could actually become COVID patients. That's very important. And you can also, by being a healthcare workers and not practicing good behavior with cleaning your hands and keeping the distance to others, you can, of course, contaminate others, and you can contaminate the community, as well as the community can contaminate you as a healthcare worker, and you can contaminate your patient. And this is actually a problem in our institution currently in many places where the investigation has been made. Next slide, please. Unfortunately, I don't see my slides. So importantly, providing that people are keeping the right way of doing and the right behavior, it won't be any problem. If you don't keep your right behavior, then you will be in trouble. And that's why it is so important to understand that this behavior part of the infection prevention strategy is absolutely key to anyone, as well as the maintenance of a clean environment where the virus cannot stay. Next slide, please. What the structure of encapsulated viruses is very easy to understand. Next slide. They are quite easy to kill. Viruses like coronavirus, COVID-19 is and are extremely easy to kill. Next slide. You understand very well why. That's an encapsulated virus, and the capsid of the virus could be actually exploded by many different products, and we'll come back on the products a little later. They can also be removed by hand washing with soap and water, for example, but they can even be faster killed by the use of alcohol-based hand rub, speaking of hands. On the environment, as you will see, many products are working. We'll come back on this later. May I have my next slide? The next slide shows you the reality of the COVID in the environment. COVID-19 or SARS CoV-2, which is the equivalent in the environment. What is in the literature regarding the transmission of this virus? There are several studies, and here is a study that is actually published, as you can see, where Zhu and et al. Looked at contamination of air and surfaces in an acute care setting in London at the peak of the first wave. As you can see, the viral RNA was detected on 52% of surfaces and actually 38% of air sampling. But the virus was not cultured. So this is very important to understand that there may be situations where the virus could be identified but not cultured, which means that the virus could be dead. The second study looked at environmental detection in COVID hospitals in Wuhan, the epicenter, the original epicenter of the pandemic. There was no air contamination that could be detected, and frequent surface contamination between 24 and 50%, depending on the type of surfaces. But no transmission from these surfaces. Next slide. The next slide summarizes again for you two studies, one from Yi et al., who looked at the contamination of surfaces in a hospital in Wuhan again, frequent surface contamination between 15 and around 32%, depending on surfaces. Contaminated surfaces included COVID-19 patients' care areas, hospital areas, and the PPE of actually the healthcare workers treating the patients. But again, no transmission that could be linked to the environment in this case. The fourth study by Dore Madden and colleagues look at environmental survival and air survival. They tested aerosolization by a machine that is a Goldberg drum. They look at 3 hours survival, and they could actually determine 3 hours survival, but then they stopped the study, so we cannot really conclude about this study, about the long-term duration of these environmental contamination. Then COVID-19 was more stable on plastic and stainless steel than on copper on a cardboard. And this is really something that is important because COVID-19 could certainly remain in the environment for hours, if not more. The next slide shows you again a study that was studied in China, looked at contamination of surfaces and air in a hospital in this time was in Changchun in China, where the positive rates of the air and surfaces, a lot of samples were conducted, was actually 3.7%, 3.5, 3.6%, and 0.77% respectively. So it means that a low degree of contamination. They used ultraviolet air filtering and a level of chlorine containing disinfectant for ambient air and floor disinfection, which was a way to reduce this contamination. But as you can see, the contamination was not that high. The 6 studies that I wanted to summarize for you is by Chin and colleague. They tested the survivability of the COVID-19 on a variety of surfaces, and RNA was still recovered after several days on a number of surfaces that were not cultured because, as you know, the culture cost a lot of money, and it's clear that that's not something that was possible in the study. Next slide. So you can see from those studies that there are meaning to that. What does this all mean? As for conclusion, I would say viral RNA is often on surfaces, and we know it can stay there for a long time. This is very clear. It is possible to keep aerosolized COVID-19 suspended in the air for a long time in controlled experimental conditions. Disinfection procedures drastically lower the viral RNA recovered from the environment. But it is difficult to culture viable viruses from the environment for different reasons. First of all, viruses are always difficult to culture, but second, most of the time the laboratories are not equipped to actually conduct the culture in the environment and even in the laboratory. Next slide. The next slide is to remind you that there are many types of products that kill SARS CoV-2. Next slide. And clearly, it's heat, steam, detergents, alcohol, sodium hypochlorite, quaternary ammonium compound, UVGI, and others. So there are many, many ways to kill COVID-19. COVID-19 is not difficult to kill. That's very important to keep this in mind. Next slide. Well, ePay, you can go to ePay tool, you can browse product, you can search by ingredient, by registration, by environment type, by contact time, and so on and so on. So I will encourage you to access this website because you can find a lot of answers to your questions by accessing this site. Next slide. There is a debate. The debate is around aerosolization. Well, what is very important to remind is that the R0, the R0 for SARS CoV-2 versus other airborne viruses is totally different. When we speak about airborne viruses, we speak about varicella, we speak about measles, we speak about tuberculosis as a bacteria, as an example of aerosols that can really spread the disease. Those viruses or bacteria have a R0, which is between 8 and 16 or even 20. Here we have a R0 between 2 and 3, and we can reduce these R0 by very simple procedures like social distancing, hand hygiene, and cleaning of the environment, which means that the virus by itself cannot spread for hours in the air, which means that the cleaning of the surface cleaning of the environment is absolutely critical for these viruses. There is a difference between the technical versus the clinically urgent way of cleaning, and the technical aspect of aerosolization can be discussed, but in fact it should not today, as of today, change our way of treating the environment. And then the WHO and the CDC perspectives are that, yes, we need to continue to do research to better understand the possibility of aerosolization be a risk factor for disease. But today, we haven't changed our practices because of the main reasons for transmission being hands and droplets. And speaking of the environment, meaning simple, usual cleaning of the environment. Next slide. Well, we reviewed these in a paper we published where we put some context to the aerosolization debate around SARS-CoV-2, and then encourage all of you, you get the reference to access our paper. Next slide. Next slide is revisiting for you the importance of a clean hospital room. There are studies assessing the risk of acquisition from prior room occupants by organisms. And on this slide, you see a lot of different organisms, most of them being, of course, bacteria, because we know that if a room is not properly cleaned after a patient has been admitted with these multi-resistant bacteria. Why do I say multi-resistant? Just because most of the studies have been conducted with multi-resistant bacteria or with Clostridium difficile, which could be recognized as some sort of multi-resistant bacteria. And actually, you can demonstrate that if the room is not cleaned, you will actually acquire the disease if the procedures are not well performed. So in other words, there is a risk for you to be admitted in a room where somebody else has been admitted before with a multi-resistant bacteria, or in some case with some viruses. We know this for noroviruses, if the room is not appropriately cleaned after the patient that was there before was actually not cleaned appropriately. Now, for COVID-19, we still don't have the data to provide this evidence to you. But to me, it is very clear. Now that we see a lot of outbreaks in hospitals because healthcare workers that could be infected, could be in contact with patients and the environment, now that we see patient rooms where one patient is coming and another is coming in the same room and get infected very quickly thereafter, it's very clear that there is a odds ratio for disease that is increased if you are admitted in a room where a COVID-19 patient has been admitted or is currently admitted. The degree of risk is still not assessed, so that's why I cannot add anything to this screen, but it is clear that the risk exists. Conclusion, it is clear that maintaining a nice and properly maintained environment is key for the fight against COVID-19 today in healthcare settings. The next slide. The next slide is addressing the issue of reusing disposable and local production. On the left-hand side, reusing disposables like actually masks has been studied for COVID-19. It was very, very key. And on the right-hand side, the local production of alcohol-based hand rub formulation, which is so important. Next slide. We'll discuss with you making it easier for hospital to decide whether or not you would have to reuse masks. Today, it doesn't look very important, but I can tell you that in March, it was the case. So look at this reference. This paper is actually submitted for publications and would be published soon, but we developed a strategy to make it easier for you to decide whether or not you would have to actually sort of reuse your mask and re-clean your mask. So I will encourage all of you to access this material as soon as it will be available. It will be on the website of our Clean Hospitals strategy. I know it will be very useful, in particular in countries where mask is a problem and where shortage of mask was real and could be real again during this second wave. Next slide. To go relatively fast, we did a systematic review. I don't have time to go into the details of this review, but we conducted a systematic review to look at the different evidence from the different studies of the value by using that or these type of methods to clean and disinfect and sometimes sterilize masks in the hospital, whether they were FFP2 or surgical masks. We, of course, concentrated on FFP2s because FFP2s are the main object that have to be used in most conditions in hospitals, but this, of course, is well understood for other type of masks. Next slide. Next slide is the other part of the systematic review. I will not give more details on that. The next slide. The cost and value of environmental hygiene is actually extremely important, as you may understand. Next slide. Now, importantly, why is it difficult to figure it out? Costs are not cleaning. Cost of not cleaning can affect numerous budgets within the hospital, and it's very clear. The cost of not cleaning is much higher than anything else. You need to look at both expenditures and averted expenditures, including patient days, opportunity cost, staff time, missed surgical revenues, averted infections, and so on, to really figure why is it so difficult to figure out the cost, but also why is it that not cleaning can affect very, very much your budget and your conditions in your hospitals. Next slide. Now, I give you an example here. You have an increase, in this case, of market growth that will accelerate at a very high way, speaking of the impact of COVID or COVID-19 analysis. There's an incremental growth that you can imagine, and there are the growths that are expected for 2020. I will encourage all of you to access this material. It's clear that we are now fighting everywhere around the world in more and more hospitals against COVID-19, and that there will be a need for perfect maintenance of the environment. Next slide. You all know better than anyone else that cleaning is a science. So it's very important for all of us, and Clean Hospitals is working on it very, very strongly. We all need to actually continue to develop good science to provide the evidence for the benefit of cleaning in hospitals, and that's very important. Next slide. So there is a difference between cleaning and disinfecting. Both reduce microbial contamination, but there is a difference in the amount of reduction. Cleaning, the process of the physical removal of dust and dirt, which also removes some microbes, is really key by using surfactants or scrubbing. Disinfection is a process of killing microbes through the use of procedures or chemicals, which means that you are really killing the microbes and making the microbe disappear. You use heat or alcohol or whatever you use. Next slide. So this is very important to think about it. The real question is, what is the cost of not cleaning? And it's important to invest in quality because it's worth it. And I think that all is there. The problem of not cleaning the environment today is that you are putting patients at risk of COVID. It's very, very clear. So we need to continuously demonstrate the importance of cleaning because what it costs not to clean is too high. Next slide. Now, cleaning a hospital, what does it mean? Does it make any difference from cleaning a school? Next slide. Of course, yes. Of course, yes. There is a difference in vulnerability of the population. There is a difference in the level of contamination from the sick patients. There are pathogens in hospitals that can differ from those in the community. There are huge difference in needed level of cleanliness depending on the zones. There is a range of specific environment that you should deal with, and there are pathogen transmission patterns that are different all over the place. Speaking of host affinities, microbiological characteristics, and so on and so on. So yes, the cleaning of hospital is different from the cleaning of school or hotels, and we need to have the better qualified people, the best products, and the best technique in those places, like hospitals and healthcare settings. The next slide. In conclusion, cleaner hospitals mean safer hospitals. It's very, very clear. Cleaner hospitals are really at the center of the control of this COVID epidemic. Healthcare environmental hygiene is a key component to ensuring safety in pandemics. That's very, very clear. We need to focus on the real dangers and evidence-based test best practices. We need to make sure that our interventions are safe and based in science. And with these, I would conclude here with the next and last slide. Next and last slide, please. Okay.
This was your last slide.
It was just to thank everyone for your participation, to thank the partners of Clean Hospitals who have been working with us in delineating the most important parameters for having maintenance of hospital environmental cleaning. So it was just to address all of you to access our website, the Clean Hospitals website, where you could find a lot more information about it. But of course, Pierre Parnex, who will speak right after me, will give you more information, being also part of the Clean Hospitals strategy. Thank you very much.
Thank you so much, Professor, for sharing so much relevant information with us. Thank you so much. There's one question from the audience. If you're watching the professor and you do have questions, please use the chat functionality in the platform and I will relay the question for you. There's one question from Emily Janssen. How much of the spread of COVID do you think is because of a contaminated environment?
Well, today we don't know. We don't have the answer, the precise answer to the question. That's why we need more evidence. It's very clear that there is a lot of spread of COVID in the community that is simply linked to droplets and the absence of hand hygiene at the appropriate time. And of course, hand hygiene works on the environment. Right? It means that if I touch the environment and I clean my hands, and then it's okay, because cleaning hands is extremely efficient to kill bacteria on your hands. Now, if I touch the same environment and this environment is clean, it's clear that it makes a big difference, speaking of the risk. But this risk has not been assessed. Now, the best place to probably assess this risk is certainly the hospital environment, because patients are sick, patients are really, so it will be the tip of the iceberg of the demonstration, if you like. Today, there is no really good study that can demonstrate to you what is the risk, speaking of an odds ratio, that I will be comparing on the slide that I showed you earlier. To me, it looks like it's quite high, speaking of what I've seen in different hospitals in different countries, because you can see that as soon as you have one patient in a COVID room, if the COVID room is a one single room or a room with 2 or 3 patients, the difference is absolutely evident. Whether it's bad practices by healthcare workers or bad practices by room cleaners, I cannot tell today. And I don't think anybody can tell today.
You mentioned the aerosolization discussion that is taking place in this country, but I guess all over the whole world. Could you put a percentage on the number of infections through aerosols?
No, it's totally impossible yet. People are looking for it, and despite of a very, very large number of studies trying to look at the spread by aerosols, we are not speaking about droplets. We are speaking about aerosols. If I take the example of influenza, where we know about it, there is 70% of the transmission is linked to hands. So it means direct through hands or indirect through the environment, and around 20-30% through droplets. There is no transmission via aerosol, only few exceptions. I don't think it's that different for COVID-19. I don't think it's that different for COVID-19. I think probably the role of the environment for COVID-19 is a little more important, but I don't think the role of aerosol is that important at all.
Gil Aitken has a question for you. The WHO and the CDC say that in enclosed spaces with reduced ventilation, there is increased risk of contamination. His question is, what's your thoughts on devices such as ozone ionizers and air purifiers for use in these spaces?
We need controlled studies. So far, it's the CDC and the WHO are giving weak recommendation on these. Whether we need to open the window is a good idea, but the demonstration of these is not made. The environmental decontamination by this type of technique is interesting. I don't think it's a bad idea, but yet the evidence is that by cleaning the environment using regular, usual technique is certainly enough. In some conditions, we may imagine to use different techniques for different purposes, but today, those techniques are not mandatory or necessary to control COVID.
So the basic rule of thumb would be to clean the surfaces as good as possible.
Absolutely. Clean the surfaces as good as possible using the appropriate technique, and the appropriate product is certainly absolutely key, but no need for any magic to clean the environment.
No need for magic, because the virus in itself is easy to disrupt,
Yes.
to kill, the word you used. All right, we have one more question. Diego Javier is asking, how do we convince the hospital staff to invest in cleaning in disinfection?
Well, it's true that it has been a very difficult issue for many, many years. This is really what we are doing with the Clean Hospitals initiative, which is to make sure that the right investments are made at the right place to train better the personnel, to teach better, to get better products that are more easy to use, environmental friendly, and the cost effectiveness should be addressed. But Pierre Parnex would be addressing part of it in his talk.
There's a second layer in this question, or actually a statement that I would like to hear your reaction on. Diego Javier writes, we offer new techniques and science, but the hospitals, are mainly focused on old methods, corrective methods, not preventive ones.
Well, in this case, nowadays, speaking of COVID-19, the so-called old methods are okay, provided that they are applied. If new methods are coming or currently available that are less expensive, less complicated for the house cleaning personnel, more efficient, but today we haven't seen any more efficient technique, speaking of the reality of daily life of hospital environmental hygiene, we are all open to this discussion. The problem is the application of the measures and make sure that we have enough people to do it or a good material to do it so that it could be perfectly done.
Evelien Eggerink is asking, is only disinfection or only cleaning in a hospital room enough for prevention to COVID-19, or is it always necessary to do both?
Well, as always, you need to clean first and disinfect. You don't need to disinfect all the time. Cleaning is absolutely key. But of course, if you do both, it would probably help better the environment. But so far, we don't have any scientific evidence. And again, this is the Clean Hospital initiatives is really here for that, to make the demonstration of what needs to be used. And of course, if tomorrow there would be a new technique that will save time for the healthcare personnel, money, and sort of clean better and faster the room, everybody would be happy about it. And we need to then demonstrate the cost effectiveness of the strategy. But the cost effectiveness could only result in demonstrating a reduction in the number of infections or cross-transmission to other patients in the hospital, for example.
Professor, thank you very much for now. Please stay tuned for maybe some questions later on in the program.